What do medical doctors think of chiropractors? This is something that we often get asked in the clinic and also via email and on social media. And I think it's really important to distinguish between the two, but also understand what the hearsay is and why that may be there as well. So for full disclosure, I am a chiropractor and we call ourselves doctors of chiropractic. We have to be very specific about that because we cannot prescribe medication, nor do we want to. We want to distinguish ourselves from medical doctors. And I'm not saying that prescribed medication is a bad thing. I just believe that as chiropractors, we try to heal naturally and use the body's natural healing capacity. So there's a lot of myths out there. There's also a lot of truths out there in terms of the differences and also the opinions that doctors have of chiropractors. So I cannot speak for a doctor because I'm not a medical doctor. I don't know exactly what they are thinking unless there was one here that we could interview. So if you are a medical doctor out there and you'd like to come on the channel, it'd be great to have a conversation and kind of talk about the differences so that people can get better informed and understand the differences between the two. So as I say, my name is Dr. Jeremy Andrews. I'm a doctor of chiropractic here at West Chiropractic in Surrey, and we help people with chronic lower back pain and knee pain avoid a lifetime of painkillers and surgery. The first thing out there is sometimes there is some confusion about how chiropractors get their qualifications. So let me run you through it. Chiropractors have to do 5 years of studying. So the first 2 years is pretty much everything that a medic would do in a UK-based university. So we do all of your anatomy, we do mammalian anatomy, we do physiology, pharmacology. We obviously have a lot of technique training as well, learning to be safe. We have your diagnosis, so we have to be able to diagnose everything that a medic would be able to diagnose. We don't necessarily need to treat, but we just need to be able to refer on. So if someone came in with something sinister, a sinister pathology, we have to be able to recognize the red flags and be able to refer that on to the right professional, which could be a GP, it could be an orthopedic surgeon, it could be someone in oncology. We have psychology training, behavioral science, we have radiography training, so we can actually take x-rays and we're trained to take them. And we're also able to read x-rays and MRIs as well and be able to make relevant recommendations from them as well. We have orthopedic training, we have neurology training, and we also have pediatric training as well. So if you do want to go and work with kids, babies, that's a very popular chiropractic technique to focus on. We need to make sure that the students are proficient in that also. And then we also do a lot of rehab, sports rehab, rehabilitation, ensuring that the muscles are working well, and we have exercise programs in place. So those first 2 years can be relatively similar to what a medic would do in a UK-based university. And obviously in the third year, the medics will advance their studies and they'll be much better than us at your diagnostics, your pharmacology, prescribing, all of that. And so they should be. That's what they spend most of their time doing. And then chiropractors, in our third, fourth, fifth year, we keep on honing those skills. We do a lot more technique-based hands-on training, patient management, understanding diagnostics, and trying to get the best out of our skills for those years. And then we also have 2 years in clinic. So there's a clinic on site at the university that I studied at, which is the AECC down in Bournemouth. And you have to see a certain number of patients. The time when I was there, we had to do 400 treatments in the year. And we also had to see 40 new clients. So 40 new patients with different conditions or be able to diagnose things. And we had to write them up as well. We also had our lectures around that. So it's quite a full-on couple of years at the end there, ensuring that we are proficient to be able to be let out in the big wide world. Medics obviously will have their 5 years. They go to hospitals. They then have much further training, more advanced training as they specialize as they go through. So chiropractors, when they finish their 5th year, they can in theory go out and start their own practice. Most chiropractors will go and work as an associate for a few years underneath somebody to understand how a clinic runs, how patient management runs, to develop their skills and be mentored by somebody. I was mentored for 4 years by a clinic in London where I took various courses and furthered my skills and my learning. Medics, obviously, they have a mandatory training program to go through. So they're F1, they're F2, and then they start going into their specialties after that before they become a consultant. So it's a much longer period of training as they specialize and they niche down to what they want to do. So is chiropractic actually legitimate? A lot of medical doctors will look at it and say, well, there's evidence behind it, there's not enough research behind it, why should we be referring patients that come into our GP practice to a chiropractor? Well, traditionally this was the case, but over the last 10, 15 years, there's been a lot more research into chiropractic. A lady called Dr. Heidi Harvick, who's published over 50 papers around the neurology and the understanding of chiropractic and how it works in the body. There was the Bronfort report in 2010, which showed that chiropractic is one of the most effective forms of treatment over non-steroidal anti-inflammatory drugs and rehab for treating chronic lower back pain, acute neck pain, amongst other conditions as well. So chiropractic has been shown over the last 10-15 years and proven in research-based studies, RCTs, clinical studies with good evidence and good studies that it is very effective at treating lower back pain, neck pain, amongst other musculoskeletal conditions. So I think what's traditionally happened in the past is there's been some GPs and medical doctors in the older generations where this evidence wasn't necessarily there, and they're well within their rights to challenge studies or challenge treatment modalities that haven't got appropriate evidence. But now we are seeing the evidence coming through. I think a lot of them are starting to come on board with chiropractic and seeing it as a very effective treatment for these conditions. In America, the American College of Rheumatology and Orthopedics are showing that chiropractic is a very effective form of treatment, and it also reduces the amount of opioid drugs that are needed, the amount of over-the-counter drugs that are needed as well, and reducing the reliance on surgery in the long run also. And I think another reason that medical doctors tend to challenge chiropractic or turn their nose up at chiropractic is because of the safety element as well. So if they're going to recommend that their patients go and see somebody, whether it's a physiotherapist, an osteopath, a chiropractor, they need to make sure that it's safe. So chiropractic, as I see it, is very safe. It's a very natural alternative to surgery and taking medication. So you've only got to look at some of the surgery statistics. Spinal surgery, the response rates are very, very poor. You're looking at a 50% success rate. Success is not having surgery within 5 years. Those numbers will always change depending on what you read, but as a spinal surgeon, they will try to avoid doing spinal surgery because of the risk of infection and also failure, and also the intricate nerves around that area that could cause problems in the long run. So as chiropractors, it is very safe, but you need to make sure that you're seeing a chiropractor that's doing a full assessment, diagnostics, they are taking x-rays where they need to ensure that the risk of when you get adjusted is very, very low. So it's very, very gentle to start with. We take our time to ensure that our patients respond effectively, but also in the appropriate amount of time. We don't want to just jump on them in the first visit and cause any further damage. We need to make sure we're looking at certain risk factors, yellow flags, where we could disrupt the body and cause any side effects. The side effects could be stiffness, soreness in certain areas. That's very normal, like if you haven't been to the gym in a long time. So we need to make sure that we're appropriately showing our patients what may happen and how they can effectively reduce those side effects as well. But that is normal. The only side effects that you may have would be feeling stiff, feeling sore afterwards. Okay, so there we have it. That would be what doctors think of chiropractors. In summary, I think that most doctors are coming around to the idea that chiropractic is a very effective frontline treatment for lower back pain, sciatica, and neck issues. And the evidence is now coming thick and fast to show that we are very effective at treating those. So if you have any questions, please let me know. If you like the video, please hit the like button. Please subscribe to the channel for our regular updates. And of course, you can grab copies of my best-selling books here, How to Transform Your Back and The Secret Cure to Back Pain, How to Avoid a Lifetime of Painkillers and Surgery. See you next time.